Hi, my name's Paul Graham. I'm Managing Director of our medical team at Christie Co. It's a great honour today to be joined by the Interim Chief Dental Officer, Dr. Jason Wong. Jason, thank you for coming along.
Thank you very much for inviting me.
Jason, the topic of NHS dentistry just now is in the public domain more than ever before. Can you give us a bit of insight into what your day job is and what it entails and the hot topics at this moment in time?
In terms of the day job, it's probably one of the most misunderstood jobs in England, I would say. But there is a part of our work that feeds into the contract or system reform. And clearly the NHS has given the commitment to reform the current system. You've just made mention of the spotlight being on dentistry, and our role is to provide the clinical input into that, so to make sure that the methodology is correct. But we don't have the levers to actually make the changes that's necessary. We just try and influence the system for the benefit of patients. So our chief role is advocacy for patients, and then after that, advocacy for the profession.
Those main challenges just now, what's the profession facing, and how can you overcome those?
The profession is facing, I think, a workforce challenge. That is, and it's called. The public is facing an access challenge to NHS dentistry, but actually the whole situation is more to do with a workforce crisis. And what we don't have at the moment is really adequate information about what the workforce situation actually is. So despite, we've attempted to try and encourage, and it's really good news that GDC this year will have some data in which to use, and it will be based around the December 2023 collection, and to ask the profession what roles they're doing, whether it's clinical, non-clinical, whether they're involved in NHS practice or private practice. Because until then, we really don't know what the workforce is actually doing. So people refer to, there are 40,000 dentists registered with the GDC, and we actually find that the work patterns of people have changed. What used to be sort of 5 days clinical a week being the standard is probably not that anymore, and people are choosing to do more of a portfolio career as well. So you have very different in terms of delivery. The other thing is that I think we've been very reliant on international graduate input. So if you look at the number of international graduates coming in, sort of from 2006 to 2016, 2017, most of those years we actually had more new registrants from international schools than we actually produced ourselves. And that started to tail off actually around about 2013. Really wasn't helped by political situations such as Brexit, if you can imagine, and then the pandemic. So, I think that certainly we became quite reliant on international recruitment. We don't think that's been at the same rate. We think that the new professionals that are coming through maybe are not wanting quite the hefty clinical commitment as well. Distribution across England is very different. So until the pandemic, there wasn't really a access or workforce issue in the centre of cities. And that comes from not just the population push towards moving towards the city, but actually young professionals in particular wanting to be quite close to sort of city conurbations, both for social life and indeed for referrals as well. So they don't want us to be out in, let's say, Lincolnshire and say, you are 90 miles from the closest restorative specialist unit. So suddenly, especially if starting out your career thinking, if I need help, it's a long way away. And also just a general sort of lifestyle, how they like to be near their peers, and you need a certain sort of concentration. But I think overall, there probably is a number issue in terms of just the sheer numbers when you look at how many dentists we actually produce, and then you look at the population growth and other aspects of society. Plus, at the moment, it's not just dentists. I think dental nurse recruitment is an issue as well, and that's having a real break on the system. So I think certainly post-pandemic, we're still in the midst of trying to work out how to get over the workforce issue, and then how that workforce will then settle into providing the care that we need them to.
It's interesting you mentioned the pandemic and the trends that have emerged since then, and we are seeing at a brokerage level as well. Those who are exiting the profession have perhaps come out of their core NHS businesses or mixed practices. The buyer profile just now is very much leaning towards private dentistry. I would say though, I think we're just starting to see a little bit of a turn in that thought process again. And I think that's to do with the cost of living, the rising cost of everything. I think there's a profile, a demographic there that is leaning towards NHS. But as you mentioned, the component of what the NHS is and that offering has to be fixed. That system, I don't think anyone's looking to remove it, but improve it is the difference, isn't it? Is that going to be possible? And the million-dollar question on timescale, how long will it take to fix?
I think you're right that the premise of the fact that there'll always be a need for a good NHS system is there. There will always be a proportion of the population that will want to have private dentistry. I think the missing part in the middle that we're not entirely sure of is, as you said, people's sort of behaviours and how they choose to access care will vary according to other factors, cost of living being one of them. The other issue is that actually dentistry is quite demand-led. So very different that, we look a lot at needs-based and healthcare is about need, but actually the inverse care law is actually really prominent in dentistry. So we tend to find that what you've got is perhaps the people that need it at least wanting to access it the most. The NHS and private dentistry need to coexist as nice as possible. They're both dentistry, they're both oral health, and really the balance of that is at the end of the day, I think, to be market driven. The limitation, going back to the previous conversation, is really where the workforce is and how the workforce chooses to spend its time, and that is where, as you say, the NHS has to find a system that is trying to improve that. They made the first round of changes sort of July 2022, but having said that, you have to say that between 2006 and the 2022 changes, there were no changes. I think nothing will be soon enough for the profession. Working in conjunction with NHS England and the department, NHS England will say, well, we took over responsibility in March 21. The profession says, we've been waiting for change since 2006. So there's always going to be that tension. It's so multifactorial. It's really difficult to say, but I mean, we're trying to see to try and push the system to find the best way of trying to get those reforms through as quickly as possible. But in terms of the movement of to private dental care, I think that sometimes the news out there is very much showing a picture of maybe crisis and challenges at that end of the scale. But actually the system is performing around about sort of 75-80%. Whilst that is not great and actually really pretty much suboptimal, it isn't quite the full collapse that's been put out there. So and I think that sometimes we can drive ourselves into sort of self-fulfilling prophecy.
And you have first-hand experience of that as not only Chief Dental Officer, but a partner in your own practice as well. What insight can you kind of take from that allows you to excel and progress in your CDO role as well? Does that give you a good conduit to look at the profession and anticipate what lies ahead?
I think it does, because I can speak from first-hand experience. And in terms of recruitment, I mean, my practice happens to sit in one of the areas that has always been highlighted for recruitment issues. It allows me to bring in first-hand experience of these are the challenges that are being faced. It also means that I think I can speak with some credibility as to what the provider out there is facing And I think keeping a hand in clinical work is also important, because one of the more important aspects of my work at the moment is really centered around making sure that the regulation is the right touch, making sure that clinical negligence is actually a system that is fair. And actually that's born out of knowing what colleagues face as they're working in practice. So I can certainly take some of that into the role as Chief Dental Officer.
Jason, the view of technology just now is in the public domain more than it ever has been. How do you see that benefiting or perhaps even hindering the NHS dentistry? Is there challenges there? I can imagine from a compliance perspective, it brings in a little bit more red tape perhaps. But yeah, I mean, when you look at that component, what does that feel like in NHS dentistry?
I think it's positive, and in fact, myself and the regulators recently had a discussion specifically on AI, and we were trying to really sort of have a look at the potential of AI, both from the perspective of is it a danger, is it a benefit? And I have to say that overall, unless we've missed something, and I do go around asking, have we missed something? We view it as being really, quite positive. The things that AI can do in terms of record keeping, maybe analysing radiography, front door entry to reception, diagnostic works, and the work throughput in terms of scanners and things like that. So actually, I think it's really, really helpful for practice that we can see the technology will be able to generate work, in hopefully in a swifter manner. And some of these technology actually have a cost saving as well. We did a bit of work on denture loss in hospitals and in nursing and care home. And it's devastating when people lose it, and yet it's not treated the same kind of seriousness as even someone loses a mobile phone or a set of spectacles. And we put in guidance that have gone out to hospitals and that have gone out to care homes to say, well, first of all, actually the profession needs to think about labelling them, but also about ways to prevent the loss and then what to do afterwards. But one of the positive things that came out of that was that that's been received really quite well by the hospital sector. Say, actually, we do need help in that. The next step, which is what some people in the profession are looking at, is whether actually someone going into hospital should have their appliance scanned and should have their mouth scanned. It's really difficult to adapt to a new appliance, especially when there may be dementia involved and someone whose compliance is quite poor, and putting through the sort of arduous process of being made, whereas a scanner could just produce these things, if that should come to the fore, and also a good set of records.
How are the NHS looking at sustainability at this moment in time?
The NHS has its net zero target times, and as a whole is moving quite seriously towards trying to meet those timings. It's quite an ambitious target. As usual, I think quite often us in dentistry sort of think of it as this is the big thing, but of course we're quite a small component of the entirety of the NHS. But nevertheless, we're all bound by the NHS target, and of course legislation about how businesses ought to be sustainable in the future. And we've actually produced 4 sort of pieces of resources over the last couple of years that at all levels, whether at the policy level or the practice level, it's going to help practices to try and meet these things and think about how to be more sustainable. We also give consideration in all the policy that we produce towards that aspect. In terms of fairness, I think those that are going to be most affected by the climate change are producing the least in terms of causing it. And then there's also the society that need it most. So I think that there is an overall responsibility. I think the only thing we've got to be careful of, is introducing things that are going to be real barriers to private businesses. So it's all about finding the right place. And it would be good to think that we can also look at the regulation side and the compliance side. Up till now, the policies that we've had have been focused entirely on patient safety. And therefore, a lot of that has been, we can We seem to have a lot of packaging in absolutely everything that we do. You know, at one stage, people were even packaging to move it from one room to the other. Also, how we process instruments, and you know, we don PPE, gloves, almost as soon as the patient is in the chair. There is a question about how severely we need to process all that. It's going to take some, I think, some bravery to look at that. And as I said, there's a balance between compliance, but it is something that that I'm determined that our office helps in sort of in providing, if you like, the guidance for the sector.
We're January 2024 now. The year ahead, what does it look like for you, and what are you keen to achieve this year?
Hopefully, we will be in a position where more reforms packages are produced in 2024. And we would also hope to see a stabilisation of the workforce situation. The NHS has produced its long-term workforce plan, but it is a slow lead that starts from 2026, but up to a 40% increase in 2031, both in dentist numbers and also dental therapist numbers. So that part of the long-term workforce plan isn't going to be anywhere near a situation where we impact the front line. So I think we need to look at how we can actually increase the numbers of graduates, international or homegrown, who are working the front line within the country. I think that's something that we definitely have to explore whilst maintaining standards. And I think, you know, I'm quite clear that what I'm not advocating for is loosening standards in order to increase the workforce, but it's finding ways in which to increase the workforce whilst maintaining the standards that we have. From a personal level, I mean, our office have committed to working with the dental policy team, and we hope that in the first 3 months we'll be getting out a document about flexible commissioning, so that within the existing system, we give the 42 integrated care boards some guidance as to how they can, both within dentistry and within oral health. So some of this, for example, you know, cardiovascular disease and the links in diabetes actually are not things that need resourcing from the dental budget, if there is such a thing as a dental budget. So it comes from other parts of health services, and the dental practice has been integrating more with the rest of healthcare. So we're hopeful that we can get that document out in the first quarter to try and get to a situation where an integrated care board can pick up an initiative and think, actually, this is where we'll work. The other thing I think we want to do is also we do need to give guidance to the system in terms of people who seek treatment in other countries as well. So our office is committed to having some kind of a note, some kind of guidance for the system to say, you know, if you see a patient who's come back with complications or without, what is the expectation for the profession to act in that way? We hope that from the workforce perspective, as I said, we can have a bit more detail so that we can see how the workforce will be encouraged to stay in. And one of the things, actually, our role is more to do with the quality of treatment, that I would hope that the system will begin to find ways in which to remunerate for quality aspects of the system. So peer review, clinical audits, that kind of thing, and how practices can do that, whilst recognizing that, yes, the reform is needed, but there's also quite a few other parts, you know, clinical standards and opportunities that actually we can get into place, as well as clinical leadership. That's one of the areas we're trying to push on, you know, having parity, or at least a system-wide parity between dental clinical leadership in the regions, in the localities, having a more equitable system compared to, you know, for medicine and pharmacy. So I think 2024, if we can nail, let's say 75% of that, I will be incredibly happy. But we would hope our aim is to nail 100% of all that. Yeah. The only thing I can say is that myself and my team will do all we can to try and achieve those things.
Well, it certainly sounds like the profession is in very good hands. And on that note, it would be remiss of me not to actually comment or mention the MBE that you were awarded for dentistry and oral health in the New Year's Honours List 2020 by the then Prince Charles. How was that?
Fairly surreal, actually, I have to say, because actually, when I received the letter, I did question whether it was a prank of some sort, because it did come in a fairly. I spoke to someone before and said, "Did you expect a horse-drawn carriage?" No, no, but it came in a very plain envelope, and I opened this thing up, and I was thinking, "This is for real." And I passed it to my wife. So yeah, quite surreal. No indication, and I still actually to this day do not know who it was that put me forward. The rather surreal bit continued because I actually went to receive it. I think it was the 10th or the 11th of March, 2020. Now, yes. So I have never seen Buckingham Palace that empty, nor that as you walk, it was beginning. My wife, my family, and I went out for dinner, and we were the only people in the restaurant. The lockdown came less than 2 weeks later, of course. Amazing. I'd never expect anything like that, and as I said, it sort of totally came out of the blue, but yeah, incredibly grateful for whoever it is, and I still don't know, but I suspect that there was a bit of a joint effort, but whoever it is that put me forward for something like that.
Jason, thank you very much indeed for your time today. It has been an absolute pleasure sitting down and chatting with you and having this incredible insight into what you do and the profession. Thank you very much indeed.
Thank you very much. Thank you very much for inviting me.